Disclaimer: the information provided in this video is for general information and educational purposes only. All information provided is in good faith. However, we make no warranty of any kind regarding the accuracy, adequacy, validity, reliability, availability, or completeness of this information.
Pre-assessment clinic. The pre-assessment clinic is a nurse-led clinic and plays an important part in the preparation for your surgery. It includes an assessment of your general health and fitness before surgery by carrying out various tests and investigations. If you have more complex medical issues, you may be seen in a clinic led by an anesthetic consultant. Depending on the type of surgery you are having or if you have been assessed recently, it may be possible to carry out your pre-operative assessment over the phone. Pre-assessment nurse. Pre-assessment nurse is a nurse who performs a pre-operative assessment which involves taking a full medical or nursing and social history. Routine observations will be recorded, which will include blood pressure, pulse, temperature, height, and weight. An electrocardiogram (ECG) may be needed. The nurse who performs your assessment will discuss their findings with the anesthetist if required. The anesthetist may wish to review you in the clinic to ensure you are fit for anesthetic and discuss possible anesthetic procedures and risks. If we find that you have problems that we were not aware of, such as high blood pressure or diabetes, you will need to visit your GP for treatment. If further tests are needed, the pre-assessment nurse will refer you to the relevant hospital department or your GP. If everything is satisfactory, our nurses will explain the plan for the day of your surgery and answer any questions or queries that you may have.
Story time.
A day in a life of a pre-assessment nurse. Featuring Dayanara Kashiwabara as a nurse and Christina Bernadette Lamed as a patient. Starting your day with a positive vibe. To do: 8 a.m. to 9 a.m., checking your assigned clinic. Preparing your clinic list in the office. 9 a.m. to 4:45 p.m., 7 patients face-to-face pre-assessment. 4:45 p.m. 5:30 p.m. telephonic pre-assessment. How to prepare your clinic. Checking patients list. Checking patients' details, including past medical history, past procedures, medications, what operation they will be having, when and where will be the operation to be done. Printing label if for blood test or MRSA test. Checking if ECG will be needed. Checking medications that needs to be omitted. Preparing fasting instructions to be provided. Checking if needs to give pre-operative medications, octenazine wash or preload. Once done preparing your list, it is time to go to your clinic. Make sure to clean your clinic. Clean all equipments that will be using, which includes ECG machine and vital signs monitoring machine. And now, I am ready to start my day with my patient. During the pre-assessment, we confirm patient name and date of birth. We will ask them if they know what procedure they will be having and when. We will assess whether they have capacity. If not, we recommend to do best interest meeting prior to surgery. Then we will ask for any allergies, past surgical history, any chronic medical problems, medications they take, and instruct them to omit medications if needed. Also, assessing their exercise tolerance. Then we'll do system review, which includes cardiac, respiratory, abdominal, general, neurological, hematological, gynecological, ophthalmic, and sleep or sleep apnea. Then we will assess for their airway using Mallampati scoring, any neck or jaw restriction, and any previous neck injury. And any history of travel outside UK, any previous admission in other hospital, or any infectious diseases, any incidents of fall and memory problems. Also, we will ask who will come, collect, and to be with them after surgery. If we find something of concern, we will refer the patient for anesthetic review. After having 7 patients for face-to-face pre-assessment, we are now ready to the last patient for a telephonic pre-assessment. Same as face-to-face pre-assessment, we gather all information that will be needed. If patient is need to have blood test, MRSA test and ECG, we will schedule them for HAH clinic before the planned procedure. If they did not receive yet their fasting instruction, we will instruct them and send it also via email together with the medication instruction if needed. After all the patients, we will do our paperworks by finalizing everything, do anesthetic reviews if needed, scanning of ECGs, medication instructions, National Joint Registry consent for joint replacements and others. Once everything is done, we will clean the room, refill the supplies used and fixed our things. We are now ready to go home.
The end.
Wait. There's more.
The pre-assessment does not end after the interview. We need to follow up the results of the blood investigations, MRSA swabs, urine cultures and others. We need to inform the patient if abnormalities are found and refer to GPs or anesthetist if required. We also need to follow up pacemakers or ICD reports from different hospitals in the UK, depends on where the patient did the procedure. Moreover, we need to follow up also the replies from our anesthetic reviews and act according to recommendation. It will even take days to complete it. And when everything is okay, we can now process the patient as fit for surgery.
Thank you for watching.
Kunyari, wag mo na lang anuhin. Tony Bailey. Good morning.
Date of birth? 18/02/2023.